what are we using right here? One of the keys to a successful ingrown toenail removal is having a tourniquet over the toe, because you want it to be a bloodless field. That's the key, because if you're putting in acid and there's constantly blood coming from the root or the matrix, what happens is it dilutes the acid and you don't get a result that you desire. So basically I put this tourniquet over it right here, and you actually grab this area, put it over. So that should keep the toe completely bloodless, but I messed up. I won't mind admitting that I messed up. You want to actually milk the blood out of the toe as best you can. How do you do that? Just by palpation. So, on there like that. Yes. Around there. Perfect. So, the next step is using a English anvil. Go in right in here. You might need some light. Go right in here. Side, first clip, second clip, going into the root right here. It's the first one. Go in here. Going. First one. And after doing hundreds and hundreds and hundreds of these, this one is actually about as bloody as it gets. Typically they're not this bloody, but that's good because that means he has a great blood flow. I don't mind blood at all, so the sides are completely clipped out. And now I'm actually about to remove this border here. So you grab it with the hemostat and you make a counterclockwise pull. You pull this much out, okay? So that's removed. So compare this to what you had before. A lot is taken out. You can see why they're painful. And now the second way, so you would take this one, which is the lateral border. You have to get underneath it, grab it with a hemostat, and then this you would do a clockwise rotation, and then pull up. And that border wasn't near as bad. Nevertheless, it was stuck in there quite a bit, so you pull that completely out. Next, you would use a curette. And what you're trying to do is completely grind out the matrix or the root. And what you have to do is, I usually grab the largest end, and you're actually trying to get out as much area as you can, pulling out some of this tissue right here, which is part of the skin remnant. That can be grabbed with the hemostat and pulled out. Look how clean it looks inside here. It's really pretty amazing to see somebody come in with painful ingrown toenail or an infection with fluid coming out, infected fluid, and having a person come back in the next couple of days and there's only mild drainage and not near the cellulitis, but that looks about as clean as you could possibly make an ingrown toenail. So you're cleaning out the border again right in here. Yeah, it looks great. That looks wonderful. Eventually that skin will heal over, back over it like this, And again, technically, he won't have an ingrown toenail for the rest of his life, again, if it's done properly. So we've done this side, we've cleaned out this side. You want to make sure there's no remnant of the toenail around. And then right here, you want to do the same thing. Right in here, the curette. So again, trying to pull out that root, trying to pull out the matrix so it'll never come back. Got to make sure you're grinding it all out as well. And then once this is done, I use the second step, which is the phenol. And they recommend 3 times for 30 seconds. I usually do 4 times at 30 seconds. And the reason why I do that is because I don't think it burns a caustic burn. It just adds to solidify that matrix is completely gone. Now if there's too much acid around the skin, you want to dab it off because you don't want to get it around the medial aspect of the toe. Typically you can stick it in like this, and I can do both sides at the same time. Get to work them in both at the same time. See, it's really not that bloody. A lot of people think it's painful, it's bloody. We have a barrier up so the patient can't even see this. But even if they see it, I'm really not that concerned because this really isn't that bloody or gory if you really look at it. So both sides are being removed. Back and forth, back and forth. Put one more in there. And I like having a CO2 laser. You can't bill for it. There's no extra money that I receive from it. But I like the way a CO2 laser kind of puts an extra amount of burning action for the root. It's really not that complicated a procedure. You just have to make sure it's numb and it's clean. I already prepped him before I placed the needle for anesthesia in it. And I'm pushing deep into the root, because if you're not pushing in it, how do you know how deep you're going? I have to block the skin. Make sure nothing's around it. Just keep on rotating it back and forth, back and forth. On this side you want to get mostly the medial aspect of the toenail. On the lateral side you want to get mostly the medial side there. Make sure that that matrix will not grow back. There was one instance where I had a small child, and children are wonderful at regrowing tissue, that I had to actually do this procedure 3 times. That's literally 1 in thousands, but every once in a while it happens. This is the last one, last application. He did really well last time. I didn't have to prescribe anything for him. How do you clean and dress this? Typically I use Vet Wrap, Coban, or Coflex on these. I typically use either betadine, or I can use triple antibiotic ointment on it. Put that on a 2x2 gauze and wrap that with Vet Wrap, Coban, or Coflex. And typically they do very well. I usually like to wrap it for a week. I usually like to have the patient soak it once or twice a day for about 10 to 15 minutes. and then they'll come in for the second post-op visit. Typically they don't have to soak it anymore, and then 2 weeks they come in for a final post-op period, and they're done. Now that was the second step. That's the phenol step. That's the acid step. And then now we're about to do the CO2 laser, which people look at it and go, wow, you're about to do a laser on it. Really, it's not too big of a deal either.